morning, and it wouldn't be a Wednesday morning without our good friend Dr. Joe Congini from Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. How you doing today?
I'm doing well. Not as well as you. Congratulations. New member into the family, huh?
Another grandchild. So we've had two in the last 3 months, Ray, and it's getting kind of crazy over here, but we're enjoying it greatly. A beautiful little boy. Thank you.
Knowing you, I'm sure you are clicking the heels for sure. Hey, on the health side of things, what do you got for us this morning?
You know, there's going to be a new look around football if it happens. Every day is new discussion about what the next step is going to be. But for right now, there's a lot of talk, and it's just kind of been for fun. If you look on some of the websites, you see some of these COVID helmet face shields, and there's at least 4 of them out there that I see kids testing. As we get not far from August 1st, where they start going into helmets and shoulder pads, if that step is allowed by the state, there are going to be a new look. And nobody loves to accessorize more than football players. They love all their different pads and things they wear. And there's these new helmet face shields this year, and there's at least 4 of them. Shutt has one that a lot of the high school kids are wearing. It's called a splash shield, and it's a disposable vinyl vinyl piece that attaches to the inside of the face mask, and it's disposable. The kids are calling it a spit shield. The professional ranks are using kind of a cooler thing from Oakley. You know, Oakley, the makers of those glasses.
Yeah.
They have they have a face shield that is really now called a mouth guard, a mouth shield. The only problem with some of these is what athletes are telling me as they're trying them out is they're trying to balance wearing these face or mouth shields with being able to breathe appropriately. And one more that's out there that a lot of high school kids is one that's worn over the face mask. And the only thing I have with that is whether it's going to affect their vision at all. There is an over-the-mask one. One is called the Night Guard, and so there's at least 3 of them. And then people are experimenting with other cloth face shields or face coverings and masks. I hear a lot of talk about masking going on your show too, that they would be wearing underneath the helmet. So there's some things that people are experimenting with, but the fact of the matter goes back to almost every day there's kind of a give and take that we hear from statements that come out from the OHSAA sounding like, hey, they're going to go forward with this on August 1st, and then one yesterday that's a little bit more, well, the governor still hasn't okayed the higher risk sports. He's okayed the 4 sports that he considered non-high risk. And we're getting to that point because I was talking to the strength coaches yesterday, and they have moved through their strength and conditioning programs, and now people are getting into sports-specific 7-on-7. Soccer is actually scrimmaging, beginning to get into some scrimmaging, and we're at about that time. And August 1st is going to be here where official practice is going to start. And on Sunday, the OHSAA came out with a statement and said they plan to move forward with all 10 fall sports and try to get them to completion all the way to tournament end of the year. So that sounded like, hey, we're moving forward. And then yesterday's statement sounded like a little bit of a half step backwards. So in this new normal that we're in, Ray, we have to just kind of live literally day by day with guidelines that come out from the OHSAA or that come out from the state or that come out from the Ohio Department of Health. The people you just had on.
I agree, Joe. I agree. And I still have my questions as much as you and I love the sport of football and soccer. Football maybe more so than soccer. Still have my questions whether they're really going to be able to pull this off or not.
Yeah, we'll see. There's so much up in the air, and some of it is tied to the school part of it, too, and that's a major issue. So all we really can do is sit back and wait day by day and see what happens and do the best we can and keep people safe down at our office. I would tell you, and I think I mentioned last week, we are back to about what our regular volume for summer would be. There are a lot of kids out there playing different sports, and so they're getting back in shape. And they're getting back to playing some sport, and we'll see what the next step happens in the next 2 or 3 weeks, and we'll keep you updated, and you keep us us updated in Akron, as you always do, Ray.
All right, Dr. Joe. Thank you very much. Good visit, my friend. Go take care of that little one, and we'll catch up with you next week.
Thanks so much, Ray. Have a great week.
You too. Dr. Joe Congini, Akron Children's Hospital, joins us Wednesdays